It's Dr. Robert Brueck. I want to make some general comments, if I will, about implant exchange. I see a lot of women in my practice that come in for exchange of implants. These implants maybe were put in 15 years ago, 20, 30, 35 years ago. And they come in for a variety of reasons. The implants are sore, they're hard, they're asymmetrical. If they were saline, they may have deflated, their breasts have gotten smaller, a whole host of reasons, or a combination thereof. Most of the time women come in because the implants have been in for 15, 20 years. They may have had a routine mammogram that shows breakage of a silicone implant, or they may wake up in a state of panic at 8 o'clock in the morning and all of a sudden their left or right breast is gone. It's because the saline implant has ruptured. I think it's important to understand and make some general comments about implant exchanges and changes that occur in the breast over time. Now, many of my patients will come in that I did 10, 12, 15 years ago, and they'll say, you know, Dr. Brueck, I think my breast is smaller. And in most cases, that's true. And the reason for that is the breast tissue over the implant has diminished in size. So if you look at a woman's breast at 20, 40, and 60, and she had nothing done to her breast, you'll see that her breast size has diminished as a result of aging. Because what is the breast? The breast is breast tissue and fatty tissue. And as we age, we lose that volume. It's true in the face. I would say right now, about 60% of the time, I will do fat grafting to the face. What I'm also doing now for the first time, and I've been doing it now for about a year or two, is when I do implant exchanges, not only do I take the old implants out, put new ones in, and cut away the scar tissue, many times I will augment the breast with the patient's own fatty tissue. In other words, we'll suction fat, say, from the flanks, the abdomen, the hips, the thighs, and use that fat as a graft to place superiorly along the peristernal area to enhance the result and make it look more natural. Most women who undergo an implant exchange will opt for a slightly bigger sized implant. And again, it goes back to my comments earlier that many women that come in have lost volume to their breasts. It's not that the implant has diminished in size, it's that the breast tissue overlying the breast has diminished as far as quantity goes. And it's a nice way to do autologous fat grafting. It really is a tremendous technique to make the result more pleasing, give more medial cleavage, more superior fullness, and really enhances it. But it's also, I want to make a comment about fat grafting. When you do fat grafting, you're robbing Peter to pay Paul. Now, it's important to understand not all that fat's going to take. I would say in the breast maybe 40, 50, 60% takes. But what's nice is it's your tissue. So whatever takes is yours. It's not a foreign substance or foreign material. In fact, in some cases, I've actually taken implants out, not replaced them with implants, but replace them with the patient's own fatty tissue. Now, I sort of think of this as sort of a two for one. In other words, we are taking fat away from an area you want it taken away from, like your stomach. I want a flatter tummy. Your hips, I don't like my bulging hips, or I don't like my saddlebags, or whatever. And so rather than take that fat and throw it away, we're actually adding it to a part of your body where you want it, your breast. So it's a 2 for 1. You get 2 for the price of 1. So it's really kind of a nice technique. And in some cases, we've been able to totally eliminate the implant and replace it with a patient's own fatty tissue. Now, a lot depends on how big the implant is, how much fatty tissue there is, and whatever. So there are decisions that need to be made prior to embarking on that road. But implant exchange is very, very popular. Again, it's an outpatient procedure. It takes on general about 2 hours to do with IV sedation. There's not a lot of discomfort. Might take a little bit more if we're going to do autologous fat grafting. Again, first 4 or 5 days lay low. Real physical activity, golf, tennis, aerobics, 3 to 4 weeks, 5 weeks. And after that, you're pretty much on the road to recovery. So implant exchange is very, very popular. And I would say that most of the time we'll take out old saline implants, put in new gel implants, or old gel implant and put in new gel implants. It's a great procedure and one that's very, very popular because breast augmentation is continuing to be a very prominent, very popular procedure among women.